Dr. Hal Scherz. Each week, we bring you the information that you need so that you can advocate for your and your family
to
with regard to your health care needs. The show is brought to you by the Docs for Patient Care Foundation, the only physician-led healthcare think tank in the U.S. The Docs for Patient Care Foundation stands for the doctor-patient relationship and for healthcare freedom for every American. We are doing the heavy lifting for everybody and have been involved in some of the major decisions that are happening in Washington. And our input is so important to allow people who are making policy to be able to come to the right conclusions. So you should go to our website, www.d4pc Foundation, d4pcfoundation.org, and contribute whatever you can, because the work that we do is for you, our patients. So please be as generous as you can. The show that I did 2 weeks ago, last time I was on the air, was a tribute show to my late good friend Herman Cain. I want to thank everyone for the very kind feedback that I received after that show, and I'd like to thank once again Grace Marie Turner, who was with me for almost the entire show to help honor Herman. It was a tough show to do. It was a nice remembrance of some of the things that he stood for, and boy, could we use him right now in this very tumultuous time of racial strife that has been manufactured, I believe, by the media more than the reality of the situation. And in this campaign season, we have heard messages from Black Americans that debunk all of the misinformation that Americans are receiving from the media. The show that we're going to do today is something that I wanted to do basically because we're hearing so much about so many things in this very charged environment with an upcoming election, and the lines between what we talk about, medicine and politics, and just issues are now being blurred because they run together. In this campaign season, we've heard the contrast between Biden and Trump, between Democrats and Republicans, socialists, leftists, and anarchists versus the Republicans, or the guardians of our American system, totalitarianism and government control of everything versus freedom. The conventions, if you've been watching, and so many people have not, and I understand why, it gets tiresome after a while, but as a political junkie, which I am, the Democrat convention, or what I like to say, the Socialist Convention of the United States, was very dark and very depressing, and didn't really share with Americans anything about hope or what they wish to do going forward, primarily because what they wish to do going forward would not be supported by the majority of Americans and needs to be kept a secret, because if people really understood what they're trying to do to our country, to our society, to our way of life, most Americans, most educated Americans would realize that this is not the America that they wish to live in and see transformed, which is what they'd like to do, to fundamentally transform America. The GOP convention, on the other hand, is hopeful and uplifting, and it has been the worst nightmare for the left. And the not on the news, and I use that term very loosely, stations that are typically Trump-bashing stations, CNN and MSNBC, to name a couple. They've not backed down a bit, but on other stations, on Fox News, they have commentators who are Democrats who really are having a very hard time finding anything wrong, anything to complain about with the GOP convention other than challenging what they're saying. But the messages that we're hearing are upbeat, and they are hopeful, and they are encouraging, and trying to get Americans to think rather than to react. What's interesting is that the Democrats, Biden and Harris and their surrogates, have offered no policy positions. And again, they're afraid to share them because they know how unpopular they would be if people knew what they were proposing. The GOP, by contrast, has highlighted the many issues to emphasize what a Biden-Harris administration would mean for America. And here are a few of the contrasts that are on the ballot in 2020. It's law and order versus anarchy. It's support for the police rather than support for social workers to handle disputes in the streets. It's a referendum about race relations, which has not been good under Democrat leadership when they had an opportunity to make it better. It's about energy and climate change and the Green New Deal versus continuing to allow America to get stronger and to be energy independent. It's about school choice versus fealty to the teachers' unions. It's about supporting the military versus retrenching and allowing our adversaries to surpass us and put America in a bad situation. It's about freedom of religion and being able to pray and follow one's faith without having to be canceled by government because you wanted to observe your faith on a Saturday or on a Sunday. But it's okay to go out and riot and loot and, quote, protest. It's about the economy, how you make it strong, not by closing the economy, which Joe Biden has said he wants to do. If a person in the scientific community says that that's what we should do, that's ridiculous. This is something that cannot ever happen again in our country, and Joe Biden would be quick to do that, and that would not be the case in a Trump administration going forward. It's about our standing in the world, how we handle our foreign policy, being respected in the world versus being subservient, fighting for American interests around the world, like destroying ISIS, versus being complicit and opposing the targets that were made and carried out in the Trump administration, like Soleimani or like al-Baghdadi. It's about allowing legal immigration and celebrating that versus opening up our borders. And you saw the those of you who watched the Republican convention 2 nights ago saw President Trump swearing in 5 individuals from around the world, and that is America. That represents who we are and who the Trump administration is supporting, the welcoming of people who want to come into this country and make America better, but doing it the right way rather than the back door and cheapening what so many people have worked so hard to achieve. And I can go on and on. The Second Amendment, trade deals, judges, Israel. The issues are the length of my arm. The differences between what a Biden-Harris administration would look like versus a Trump-Pence second term. And this is a referendum on the future of our country. And I'm going to bring this show back now to what we talk about on this show, which is health care. And nobody is talking about health care enough. But health care is a major issue. And the president believes that he is not in a position to discuss this, despite the fact that he has done so much for health care. I think that there's a sheepishness because of the criticism that he's received over coronavirus, which I'll circle back to. And the Democrats are trying to tie that to overturning Obamacare and, quote, taking away health care from people at a time when it should not be even a thought. Nobody should lose their health care in a pandemic, and that's not what Trump has done in his presidency. If anything, he has done more to support the individual patients and the rights of patients than any Democrat administration in my lifetime. Because all the Democrats want to do is put more control over health care into government. They want to centralize decisions in Washington, D.C. And Trump, in health care, has done what he's done in other areas in our country. He has deregulated health care. He has made it easier for people to get insurance that fits their needs. He has made it easier for people to go outside of insurance and to get health care from providers who can contract directly with patients. He has made it easier for individuals to get drugs with his new policies about holding the pharmaceutical companies accountable. He's been all about price transparency and trying to protect the rights of the American patients, the consumers of healthcare in this country. He's supported the right to try legislation. Over and over and over again, the president has demonstrated his desire to help the American patients, and that is not what we will see in a Biden-Harris administration. The The majority of what we've heard from the Biden campaign centers around COVID-19 these days. And I'll go back to the Biden healthcare plan in a minute. But I want to take the next few minutes to talk about what Biden has said and written on his website, which you can check out, about his criticism of President Trump and his handling of the COVID-19 crisis. Biden thinks that COVID-19 falls squarely at the feet of President Trump. He's quick to blame President Trump for his lack of leadership. And this is so laughable, coming from a man who is sitting in his basement and hasn't really gotten out and seen what is happening. You know, I have friends who are handling COVID in many different ways. And I am not being critical of people who have different opinions about what their risks are and what they're willing to do and what they're not willing to do. I do criticize people who are sanctimonious and who are judgy about other people's behaviors in this pandemic. I'll share a quick anecdote. We have a friend who has been locked up in her house with her husband, and my family, my daughter just moved to New York, and she went up there with a car, and with my wife, who took a ride with her, and she had heard that that Commissar de Blasio has made an edict that anybody coming from anywhere, pretty much, because the COVID rate of infection elsewhere out of New York now is so much higher than it is in New York. So anyone coming into New York is subject to being stopped, questioned, and then checked on by someone who works for the Department of Finance. It's usually those are the meter maids and other people with quasi and law enforcement powers, and they can come to your house and make sure that you're self-quarantining for 14 days. Well, they're not checking everybody who comes into New York by car. They are making people register if you come by plane, but not by car. It's impossible to stop every car. Otherwise, it'd be 20-hour traffic jams coming into the city. But there are flashing signs that do say that you need to call this number and register. And of course, my daughter did not do that. But we have a dear friend who I said lives in New York, who has been watching news and reading newspapers, watching news and news in quotation marks, because as a liberal New Yorker, she gets her news from places that are very different from where I get my news from. But nonetheless, for her, COVID is going outside the house is a potentially deadly event, and would not want to do that. Well, she and her husband and another close friends, a couple who also are equally vigilant about shutting themselves off from the world, decided that they would need to get out of New York and take a vacation, which they did, and they went to North Carolina. Well, our friends were so judgy about my daughter not registering coming into New York with her Georgia plates. but she was going to North Carolina to go on vacation and then come back to New York. And we asked her, well, are you going to re-register because you are coming back in from outside the New York area? And she couldn't understand that. She goes, no, I've got New York plates, as if her New York plates confer immunity to COVID. And so this is what I'm referring to in terms of people being judgy and being sanctimonious, and this is what we see happening. And Joe Biden is one of those people. He's no different than our friends who sit in their house. They gather information from sources that, God knows where it's coming from, and the validity of it is certainly not there leaves something to be considered about it. But he is making decisions in a bubble, living in his basement, not really getting out in the world and understanding what is truly happening. And it doesn't matter that he's got information coming in, he's got advisors telling him what to do. If he's not actually in the moment, then his opinions are not able to be taken seriously. And this is what Biden is saying. He's making claims about how Trump is handling this pandemic, which are unfair, they're unsubstantiated, and they're wrong. And what his website states, as far as how he would handle COVID, states the following. It says that his plan is to, number one, restore trust, credibility, and common purpose. Number two, mount an effective national emergency response that saves lives, protects frontline workers, and minimizes spread of COVID-19. 3, it eliminates cost barriers for prevention of and care for COVID-19. 4, it pursues decisive economic measures to help hard-hit workers, families, and small businesses, and to stabilize the American economy. And 5, rallying the world to confront this crisis while laying the foundation for the future. Huh? What did he say? What does his website even mean? It means nothing. And by the way, this is what Trump is doing. He's criticizing Trump for the very things that he's proposing that we should do. And by the way, as one of the former chiefs of the Joint Chiefs of Staff has said about Biden, and they reiterated this on the national TV at the RNC yesterday, and we've heard this over and over again, when it comes to substantive, and I'm paraphrasing now, when it comes to substantive issues that have confronted America, Joe Biden has been wrong on every major issue for the last 4 decades. And COVID is no exception. And the thing about what he's saying regarding COVID has absolutely no bearing in reality. He will not handle COVID any differently than President Trump is handling it. President Trump is doing everything right. He is using the experts to help guide things. He's criticized because he makes statements about treatment, which people are quick to say he should not be doing. But if he doesn't do it, nobody else is standing up for this administration and the decisions that they're making. So he has no choice but to do it. I am not critical of the decisions that he has made regarding COVID. In fact, he has done things in more cases correctly than incorrectly. Nobody knows what's going on. If you look at the CDC guidelines, which I follow closely because as a practicing physician, this is an issue that comes up in my practice every single day. How do you handle employees who are exposed? How do you handle employees who test positive? How do you handle people who are asymptomatic and have tested positive and continue to test positive even though they have no symptoms? This is uncharted territory. Nobody knows what this is about. And for Joe Biden to have the audacity to sit in his basement and criticize what our president is doing in a pandemic that nobody could have predicted, that did in fact come from China, and that he is actually whom he has held accountable to the criticism of the left, who said that and let me, this is the most ridiculous thing. During the Democrat National Convention, Not Mario Cuomo, that's his dad, Andrew Cuomo, that brilliant governor who everybody thinks is such a statesman, called this pandemic the European virus. What an idiot. And not just an idiot, but he is culpable for the deaths of between 3,000 and 6,000 seniors who he sentenced to death by sending from the hospital back to the nursing home that they came from, only to infect other people there when the nursing homes did not have the capability of isolating them. He should be not just ashamed of himself, they should prosecute him for the deaths of so many people who could have been saved by the efforts of President Trump, who mobilized a ship right off the Manhattan shore in the Hudson River, who helped mobilize a field hospital at the Javits Convention Center in New York. So for Joe Biden to be sanctimonious and criticize the president about how he handled COVID and how he continues to handle COVID, and by the way, with vaccinations, which the president is being hopeful for and is really trying to block any red tape and knock down any barriers that prevent the rapid deployment of this vaccination, should be applauded, not criticized, which is what the Biden administration is doing. So with regard to what we can expect in the Biden administration with the COVID crisis, it will not get better. It will only get worse, especially if somebody decides that we should shut down the economy again, because he is quick to do it. Now, stay with us, because when we get back, I want to tell people what you can expect from the Biden healthcare plan and how disastrous that is going to be for America going forward. We'll never be able to walk this back. So stay with us.
Hal, I'm going to take 1 second to mention that as a public service and as an organization that we have our beliefs, and I just want everybody to take a minute during the day, sometime during the day, and think about the folks in Louisiana and Texas that are being hammered by a terrible storm. So whenever you have a minute, please just think of those folks.
Thank you. I think that's great, David. I am remiss for not saying something about that today. That our prayers are with them, and people should look at helping them out and go to reputable sites, because there are a lot of people who take advantage of the goodness of Americans when it comes to crises. And there are many reputable sites. The American Red Cross is one of them, but there are other people there who are doing a great job. and I fully support what you're saying, David, and we should not just think about them, but we should take action and help the people in the Gulf of Mexico area, Louisiana and Texas, who have been hammered so badly over the last few years by natural disasters, and especially during this COVID crisis.
One last thing is that the news stated, and Trump is on top of it, and he's not waiting for it to happen. He's making it happen in giving and taking care of the folks in Texas and Louisiana. So pray for our president and pray for our friends and neighbors in Texas and Louisiana. Thank you, Al.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Scherz, as we talk about the topics that doctors talk about amongst themselves, such as Medicare, Obamacare, alternative forms of care, and health information technology. Join us every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening. You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. Today we're talking a little bit about a Joe Biden, Kamala Harris administration and what that would look like for health care. So I spent the first part of the show, the first half of the show, trying to make the case that the Democratic vision is a very dark vision and not uplifting and very critical. And that's what opposition campaigns are all about. Typically, they do spend a lot of time criticizing the incumbent and trying to paint them as a unworthy occupant of their office. But the Democrats in general, and Joe Biden and Kamala Harris in particular, have painted the Trump administration in a very dark, sinister light, which is not correct. It's not just unfair, it's a lie. And they are actually projecting. In psychiatry, there's a term called projection, which is that you take characteristics that you embrace or that exemplify you, and you put them on someone else. And the Democrat positions are almost entirely projections of who they really are. So Joe Biden does have a health care policy. It's on his website. I'm going to go through a few of these issues in just a moment. But many people believe that Joe Biden is simply an empty vessel. He is a Trojan horse. He's not really the president. He is just a figurehead. He's almost like the movie Breakfast at Bernie's, where they took around a dead guy and they brought him everywhere because everybody knew who Bernie was. and they would put him in a country club in a chair with sunglasses and a hat, and the people who brought him around were getting great treatment because Bernie was there, and they would take him to the golf course, and they would take him to the theater. They take him everywhere. That's what Joe Biden is. It's like breakfast at Bernie's. He is no longer with us. He is not making sense anymore. You heard some of the commentators on left-wing TV praising his acceptance speech as the best he's ever given. They were actually just hoping he could get through a speech without his forehead hitting the table. He was able to read a teleprompter. Some people were actually wondering whether or not this was all one take or it was multiple takes because it was taped. So I think that we are hearing a lot of opinion that Joe Biden may not even make it out of his first year. And even if he does, he is not in control. It's everyone who's around him who will be making policy. Every leftist, every communist, socialist, anarchist who now comprise the Democratic Party will be making his decisions. And that means health care. Now, Joe Biden's plan is pretty much outlined here on his website, and I'll go through a few of these, which, again, just like his COVID policy, are platitudes. They don't say anything, and they don't really accomplish nothing. When he says that he wants to strengthen Obamacare, which he was a part of creating, what he's really saying is that he wants to go to a government-run insurance option. And the government option for insurance is the back door to what the left wants to do, which is a single payer. So why do I say that? You'll hear people say on the left, no. A government option is simply an affordable health care plan for people who can't afford private insurance. So let's go ahead and give them a health care plan, an insurance plan that resembles Medicare, that will be affordable, that people will not go bankrupt over. And sure, they're going bankrupt over the Obamacare plans because a silver plan for a family of four, after deductibles and copays and all that, is going to cost somebody as much as $24,000 to $26,000 a year. That's a lot of money for nothing. So the public option, public supported insurance, is the surest way to drive the private insurance companies out of the market. Obamacare succeeded in doing that the first go around when there were 1,800 private insurance companies, and most of the small ones went either out of business or they decided to leave healthcare. Some of the bigger ones too. I remember Prudential was a huge healthcare insurance company a few years back. No longer, not since Obamacare. And so a public option will drive these insurance companies out of healthcare, making it absolutely impossible for anyone to get insurance outside of the government-run plan. That's essentially single payer. Well, the left wants to get there in one giant bite. They want to eat the pig in one bite. You've heard Kamala Harris jump on the bandwagon of Medicare for all. She did that quite quickly, the Bernie Sanders healthcare plan. And people that Biden surrounds himself with, Elizabeth Warren or Cory Booker or any of the other Obama sycophants, or even the Clinton administration sycophants, they want the government to control healthcare. And so they would like to get to that the fastest way possible. If they have to do it the back door, which is the government option for insurance, well, they'll do that. Obamacare was that vehicle that they were hoping would get them to the promised land. And in the Biden administration, he will resurrect that dream and allow for the government option to allow that to happen. But if Biden is no longer calling the shots and the left is, you can bet your bottom dollar that everything that the Democratic candidates in the primary promised that they would do, they're going to do. Don't disregard what they say. Don't ignore them when they tell you that they're going to do this. They are going to do it. They want to do it. That means that everybody in this country are going to pay incredibly high taxes. This is to start a $4 trillion program to start, and it will bankrupt the country. It will compromise the future of our children and grandchildren. You cannot pay for this, and so if you've got a promise to take care of everything, and remember that if the government promises you everything, then the likelihood is that you'll get nothing. And this is something that people need to understand. A single payer, Medicare for all, a government-run plan, socialized health care in the Democratic socialist view of things, in this new Democrat Party, which should not be called the Democrat Party anymore. It should be called the Socialist Party. What this means for patients is stark reality. It means that care will be rationed. It has to be rationed, because if you listen to the Democrats and they say, "Oh no, you can go to any doctor anytime, anywhere." What doctor are they talking about? And where? Where are they going to get this care? It's not going to be possible because there aren't going to be any doctors. So right now, doctors have diminishing revenues over the last decade because the reimbursement to doctors has remained stagnant or decreased. It's the only industry in America where that's happening. And yet the overhead for physicians continues to go up, and that's the reason why doctors either close their doors or they have to sell their practices to hospitals. And by the way, when the hospital owns the doctor, they're no longer working for you, the patient. They're working for their boss. So that's a terrible, terrible thing for patients. But that's why this is happening, because it is becoming impossible for physicians who want to take care of patients, who are dedicated to preserving the relationship between them and their patients, to be able to continue to do so financially. Well, a single-payer system means that physicians will take anywhere from a 30 to 40% pay cut. Now, I will tell you that, number one, I'm out. When that happens, I'm done. And that would be a real shame, because people like me in my generation are the ones with the experience and still have a lot of life left in us. But when they start slashing the revenue that we can produce, our ability to earn a living, and without any protection, and in fact, it will be worse because the bureaucracy is going to increase, and that means higher costs that the physicians have to endure. We will see a physician exodus like you've never seen before, and already there's a physician shortage around the country. Well, that will be worse when we lose an entire generation of physicians who say enough's enough. Young doctors who are so far in debt from college and from medical school. Now, maybe that'll go away in a socialized America, socialistic America, where the government pays for college and the government pays for medical school. And in return, you owe your life to the government for a certain period of time for a meager subsistence. That's possible. But the reality is that so many young people, the best, the brightest, are going to say, that's not what I want to do. I have an opportunity to earn a far better living working a less demanding schedule, not sacrificing my life, and they're not going to go into medicine. And that's an absolute fact. It's been shown around the country, or where countries where physicians can earn a living are just banging down doors in America trying to get in here where they can earn a decent living. But what they're going to set up is a system, the socialists here will, where you won't get to see a doctor. You'll see a nurse or maybe even a technician. And your care, your quality of care is going to go down further and further until the kind of care that you get is going to be so substandard, and it's going to be the Peter principle. It's going to come down to where it is in the rest of the world. Instead of leading the world, which we do, we will come down to what it's like in the third world when people cannot get the kind of care that they want. And we hear stories about that all the time, how people in Canada just die because they don't get screened for cancer, or in England where they don't get joint replacements because they're too old. That's absolutely coming under a Biden administration. No innovation. There's going to be no incentive to build new healthcare industries and innovation, and there's no way out of that system. So this is the reality in a Biden Harris administration. At the very best, we're going to get a return to Obamacare on steroids, or worse, Obamacare on double steroids, which is Medicare for all. So that's I think what you absolutely can look forward to. And people who are trying to minimize that reality, who are trying to discredit people like me who say that this is coming, are lying to you. They're lying to you because when the government controls things, there are some people who are going to make out better than others. People who are in government will make out better than you, who are an average person out there. People who are in tech, people who have a way to scam money out of a system that the government controls are pushing for this. They want more control in the hands of fewer people rather than disbursement of control of healthcare to every single individual around the country and let people control their own healthcare. People controlling their own healthcare is what the Trump administration is all about. The government controlling healthcare is what Biden and the left are all about, one way or the other, either backdoor through expanded Obamacare or shove it down your throat, Medicare for all. The Biden healthcare position on his website is quite clear. It says that Biden will protect the Affordable Care Act, and he will build on it by giving Americans more choice, and that means the government-run healthcare plan. He claims that they'll reduce healthcare costs. That is partially true, because if they deliver less healthcare, you can't get healthcare, you can't see a doctor for 6 months, then it's going to cost you less. But the system is going to bankrupt us when it is $4 trillion to start. He claims that he is going to give health care to Americans whose states did not expand Medicaid, and he'll give them that coverage at the same rate as Medicaid patients. So again, the taxpayer's going to pay for it. The reimbursement to physicians, and you've got to think 3 steps down the road, not just you, but what is going to happen to you when A happens, followed by B, followed by C. And when they are going to pay physicians less money and there's going to be less access, you're going to get fewer opportunities to get your health care taken care of, and that means people are going to die. And the Biden website just they restate such incredible left-wing lies that it's really truly disgraceful. The WHO lie about infant mortality being the highest in the United States of all the developed countries lie. And again, I've said this over and over and over again on this show, that American deaths in infants are counted at the minute that that baby dies, regardless of how far along they are, 23 weeks, 24 weeks. That's an infant mortality in the United States. Not so anywhere else in the Western world. And that's why American mortality rates are higher, because we're honest about counting lives, because we can save those lives, because we've got the means and the technology and the desire to do so. Not so around the world. And that's going to disappear. You can pretty much forget about the 23-week preemies or the patients with multiple problems surviving in a Biden administration, in a government-run healthcare system. Those patients will get what we call the third world treatment, the flat rock treatment. What's the flat rock treatment? Those babies will be put on a flat rock and allowed to die, which is what happens in the undeveloped world, because we are not going to have the means, the ability, the resources to take care of those individuals that right now are miracles that we save on a daily basis here. So much of what's on the Biden plan on his website are basically stealing from what Trump is already doing. And we know Joe Biden is a notorious thief of people's ideas, a plagiarist. He's known on record as stealing ideas. He's stolen ideas in his graduate and undergraduate careers. He's stolen ideas as a young politician. He's still stealing ideas, stealing the Bernie Sanders positions of socialism, which he's embracing. He's stealing President Trump's ideas. His plan is to stop surprise billing. Well, guess what, Vice President Biden? It's already been done. It's been signed into an executive order by President Trump. Now it's dependent on Congress to get through. And God willing, we'll get rid of a Nancy Pelosi-run House so we can actually see Congress enact the executive orders that President Trump has signed into orders to protect the American public. He is Vice President Biden's position is to lower costs and improve healthcare outcomes by partnering with healthcare workers. Again, he doesn't make any sense, and the people who are advising him are just engaged in platitudes to try to confuse the American public and to give people the false impression that he has a plan, that he really understands these issues, and he has absolutely no understanding. His website states that they're going to repeal outrageous drug company price gouging and exemptions. President Trump's already done this. So the things that Joe Biden is telling the public he is going to do has already been done by President Trump, who is the best president for patients in America and will even do better in a second term, especially with a Congress that is willing to work with him. And by the way, this is a vice president, a presidential candidate who believes that late-term abortion is okay. And you can have a position on abortion, when, whether or not you want to do it or not do it, when to do it. But infanticide, I think we can all agree, is a crime. It is a crime against humanity. And he has not spoken out against that. In fact, he wants to restore the federal funding for Planned Parenthood, which is abysmal. So I hope that I've given you an understanding about what a Biden healthcare world would look like versus a Trump healthcare world, and you need to really take that into consideration when you are talking to your friends and family about the differences between Biden and Trump, and especially on November 3rd when you are in the poll at the polling booth. So thanks for being with me today, and come back next week and join my co-host Dr. Scott Barber in the next edition of the Doctor's Lounge.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.